Hello everyone, welcome to our YouTube channel Pharmacology Made Easy. In this video, we will talk about all important drugs starting from alphabet A. So, before starting the video, please subscribe our channel for more pharmacology or pharmacy videos. So, starting from alphabet A, there are numerous drugs which are important. First one is abciximab. Abciximab is monoclonal antibody that inhibits the binding of platelet glycoprotein 2b3a receptors to fibrinogen. The other drugs included in this class are eptifibatide and tirofiban. These are actually monoclonal antiplatelet antibodies which inhibits the binding of platelet glycoprotein 2b3a receptors to fibrinogen. They are used to prevent clotting after coronary angioplasty and in acute coronary syndrome. Next drug is acetaminophen. Acetaminophen is antipyretic analgesic, very weak cyclooxygenase inhibitor, but it has not any anti-inflammatory action. If we compare this drug from aspirin, this drug causes less GIT distress as compared to aspirin, but if we take it in overdose, it will cause hepatic necrosis. The antidote for acetaminophen is acetylcysteine. Next drug is acetazolamide. Acetazolamide is carbonic anhydrase inhibiting diuretic which act in proximal convoluted tubule. The other drugs are dorzolamide and brinzolamide. What their drugs do? They produce sodium bicarbonate diuresis. They inhibit the carbonic anhydrase enzyme located in brush border or cytoplasm. Due to diuresis of sodium bicarbonate, there is depletion of bicarbonate ion and metabolic acidosis occur. It is used in glaucoma and mountain sickness. What are the toxicity? The toxicity sign symptoms are paresthesia, hepatic encephalopathy. The other drug is acetylcholine. Acetylcholine is cholinomimetic prototype. Acetylcholine is neurotransmitter in central nervous system, enteric nervous system, all autonomic nervous system ganglia, whether sympathetic or parasympathetic. Parasympathetic postganglionic synapses, also present in sympathetic postganglionic fiber to sweat gland, specialized apocrine sweat gland, and also present at skeletal muscle and plate. It is a parasympathomimetic drug. Next drug is acyclovir. Acyclovir is antiviral drug. The other drugs in this class are famciclovir, penciclovir, valacyclovir. These are antiviral drugs which inhibit DNA synthesis in herpes simplex virus and varicella zoster virus. These drugs are pro-form, pro-drugs. They require activation by viral thymidine kinase. Toxicity occurs which include behavior effects and nephrotoxicity, specialized crystal urea, but minimal myelosuppression. Next drug is adenosine. Adenosine is anti-arrhythmic drug which is included in miscellaneous group of anti-arrhythmic drug which is used parenteral only. It hyperpolarizes AV nodal tissue, so it blocks conduction in AV node for about 10 to 15 seconds. It is used for nodal re-entry arrhythmia. What are the toxicity of this drug? These include hypotension, flushing, and chest pain. Next is albuterol. Albuterol is prototypic rapid-acting, short-acting beta-2 agonist. The other short-acting beta-2 agonists used in acute asthma are terbutaline metoprolol. The long-acting beta-2 agonists include formoterol, salmeterol, used for prophylaxis, while indacaterol, vilanterol, these are also long-acting beta-2 agonists are used for COPD. Next come alendronate. Alendronate is bisphosphonate. The other drugs include atidronate, pamidronate, risidronate. What the drugs do? If treatment with low doses, these drugs increase bone mineral density and reduce fracture. But we increase dose, then these drugs lower serum calcium, causes hypocalcemia. They are used in osteoporosis and also for hypercalcemia in bone cancer, which is Paget disease and bone malignancy. What are the toxicity of this drug? These include esophageal irritation at low oral dose. But if we increase the dose, then renal dysfunction and osteonecrosis of jaw occurs. Next come aliskren. Aliskren is renin inhibitor. It reduces level of angiotensin 1 and angiotensin 2 used in hypertension. What are the toxicity of this drug? Angioedema, renal impairment. Next come allopurinol. Allopurinol, it is anti-gout drug. The other drugs include febuxostate. This drug is irreversible inhibitor of xanthine oxidase, so it reduces production of uric acid used in gout and adjunctive therapy in cancer, chemotherapy. Okay, it inhibits metabolism of purine analogs, which include mercaptopurine, azathioprine. Next come Alteplase. Alteplase is thrombolytic agent. The other drugs include ritaplase, tenecteplase. What the drugs do? They are human recombinant tissue plasminogen activator. They are used to recanalize occluded blood vessel in acute myocardial infarction, pulmonary embolism, stroke. Streptokinase is a bacterial protein with thrombolytic properties, and their toxicity is bleeding. Next come amiloride. Amiloride is potassium sparing diuretic. What does drug do? It blocks epithelial sodium ion channel in cortical collecting tubule, and their toxicity is hyperkalemia. Amilorone. Amilorone is group 3 anti-arrhythmic drug, broad spectrum. The other drugs include ibitolide, which is more selective for atrial fibrillation. Amidrone blocks sodium, potassium, calcium, and beta receptors. Very broad spectrum action, high efficacy, and very long half life. Its toxicity include deposition in tissue, skin coloration, hypo and hyperthyroidism, pulmonary fibrosis, and optic neuritis. Next come amphetamine. Amphetamine include indirect acting sympathomimetic. The other drugs include ephedrine, pseudoephedrine, tyramine, methylphenidate. These indirect acting sympathomimetics displaced stored catecholamine nerve ending, and they have marked CNS stimulant action and high abuse liability. They are used in attention deficit hyperactivity disorder, for short-term weight loss, and for narcolepsy. Their toxicity is psychosis, hypertension, MI, seizures. Next come amphotericin B. Amphotericin B is antifungal drug. It is polyene, binds to ergosterol, and increase permeability in the fungi cell membrane. Okay, next come atenolol. Atenolol is beta 1 selective blocker which has low solubility. Okay, low solubility, and it has less CNS effect, used for hypertension, angina. The mnemonic start for beta blockers include A through M, except for cetirolol, salvidalol, labetalol. Toxicity include asthma, bradycardia, AV block, heart failure. Next come atropine. Atropine is muscarinic cholinesterase blocker, lipid soluble, so it has CNS effects. It is antidote for cholinesterase poisoning, specialized for organophosphate poisoning. Toxicity include red as a beet, dry as a bone, blind as a bat, and mad as a hater. The other drugs include cyclopentanolate, tropicamide, which are antimuscarinic for ophthalmology, cycloplegia, mydriasis, glycopyrrolate, have less CNS effect. Last drug of this lecture is azithromycin, which is macrolide antibiotic. The other drugs include calithромycin, okay, and erythromycin. It has greater activity against Haemophilus influenza, chlamydia, streptococci. Toxicity include GIT distress, but no inhibition of metabolism, while clarithromycin inhibit drug metabolism. This was all about drugs starting from A alphabet. So if you like this video, then you have to subscribe this channel. Stay tuned and thanks for watching this video.